right, all of those things. But doesn't confer with others, doesn't take advice, doesn't ask questions. Whatever it sees, it believes. Doesn't understand, play, pretend. This manager has to have two things, and it has to have the way of getting them in order to survive. If this manager gets cut off from oxygen, it dies, and the plant dies. Or if the manager gets cut off from sugar, from its food source, then equally it will die. And it has to have it second by second. It has a very small time window that it can go without anything. Now, in order to get those two things, it has to have circulation. It has to have the transport mechanism to get to it. Important is to understand there's a control room manager, and this control room manager has to have what it has to have. And if for any reason it doesn't get it, it all stops. It all goes down. All right. The other thing is to remember that this control room manager does not understand play pretend. It believes whatever it sees on the gauges, and it takes input from only its sensory inputs and from comparing all the gauges and the indicators of the processes going on. Reason that's important is when we talk about shock, and I was fortunate that the fellow that was my instructor as an instructor when I became an instructor had a very interesting position, and this is an opinion. This is not content that you have to learn and know or even agree with, but his opinion on the importance of shock was that his statement was, ultimately, shock is the cause of death for everyone. That's how important this is. The ultimate cause of death for all people is shock. Okay, so let's consider shock for a minute. Shock is defined as the inability of the brain and body to provide adequate circulation to the vital organs. Ultimately, if circulation can't be provided to the vital organs, particularly the brain, then death ensues. There are, for those of you that are tracking technical terms and want to put this in terms of classical anatomy and first aid, there are 4 types of shock. We're going to deal primarily with only one of them. But the 4 types of shock are electrical shock. We're not dealing with that. Anaphylactic shock, a severe allergic reaction, release of histamine in the presence of an allergen. We're not dealing with that. Psychogenic shock, the result of the body seeing or experiencing something horrible. We're not directly dealing with that, although that has something to do with it. And the type we are dealing with is hypovolemic shock, low volume shock. This results from a massive fluid loss to the body. Fluid loss can be from a variety of causes, loss of blood, burn, severe burn causing massive blistering where the serum manufactured has to pull its fluid straight out of the circulatory system. Could be even diarrhea and loss of body fluid that way. Can be any of a number of causes, but low volume. Most common is from a bleed out, from a wound of some kind. Now that can be either an external wound with external visible bleeding, or it can be internal bleeding, wherein again blood is lost from the closed circulatory system. The control room manager that we're talking about in this circumstance is, you can imagine, as encapsulated in an area where they get all their information, but they are in the center, approximately in the center of the skull, at the area where the spinal cord meets the brain. It's the control interface between the brain and the rest of the body, and comprises the parts of the brain called the cerebellum and medulla oblongata. Again, you don't have to know the terms, but for those who are tracking terms, there's the information.